So I wanted to explain the hammer technique that I use in the clinic and that I use with a lot of the patients that I see for lower back and hip pain. Here I'm with Brad Tavares, a UFC middleweight, and he presented to the clinic with some back pain, with left-sided hip pain, and with decreased hip extension mobility. So right now I'm testing his hip extension, range of motion, and I'm seeing that on the right side is a couple inches higher and easier for him to move than the left. So I contact with the hammer and chisel on the SI joint on the left side, and then I'm basically oscillating and mobilizing the SI joint in order to increase that hip range of motion. This is typically not a painful treatment. You just feel the pressure of the chisel and the oscillation when the hammer hits the chisel. Right now I'm oscillating on the left side, trying to correct that posterior tilt of the pelvis. After I do that, then I retest the hip extension and see if there's any change in the range of motion. I also try to ask the patient if he feels any difference with the movement once I do the treatment. I contact again on the hip, always keeping in mind the angle and the positioning of the chisel on the pelvic structure. I retest the hip extension again, and as you can see, it's considerably higher than the first time he tried. He also said it felt easier to move, more fluid the motion, and easier basically all around just to extend. There he relayed that it was much easier to move, and then I move the contact point on the ischial tuberosity or the sits bone. That's where the hamstring's attached to, and I'm trying to mobilize the left pelvis a little bit more superiorly. I'm always retesting, seeing the hip extension, and I'm also trying to keep in my mind the picture of the pelvis and the exact points that I'm trying to contact and seeing what would be the best leverage to use. After I'm done with the hammer therapy, then I go into high velocity, low amplitude manipulation of the lumbar spine in order to decrease that stiffness and pain when moving of that joint. In the clinic, I follow up with some manual therapy, some deep tissue, and if the patient needs it, some dry needling, cupping, whatever is needed to decrease that pain, increase that mobility.